Hey, Lake Charles, Russ Silvers, once again, your CBS on the Lake guy. This is another exciting edition of Doctor on Demand. Dr. Emily Pierce, she's with MAXX Physical Therapy. Seniors, let's talk about seniors. As the subject's getting closer and closer for me every day. When we talked about seniors off camera, though, your eyes lit up. You legitimately, honestly, love them.
I really do. I really do.
In fact, I heard you told one of the receptionists, I want all the people over 65. I want them all.
Oh, yes. It's an instant love for me.
All right. Well, when you think of physical therapy, I think of anyway, you've had surgery, you got to get a little bit better. You've had an injury, you got to get a little bit better. Athletes, certainly you can train those. But how do you train, how do you train a senior?
And to be honest, I train them similar to the athletes.
Really? Is that right?
Yeah.
Because I guess athlete, that's a very broad term, isn't it?
It is.
Okay.
It is.
So what kind of things do you work on the senior?
So we work on mobility, increasing mobility, increasing balance strategies, and increasing strength.
Strength, that's a problem because when people stop working in the workforce, sometimes they become a little too sedentary.
Correct.
And that will you'll pay a price for that. Not right away, but over time, that will kind of add up on it.
Right, yeah. It leads to muscle wasting and atrophy.
Yeah. So the way you deal with that is the same way you deal with an athlete, but on a slightly different level. So what are some exercises they might do here?
Right. So it really depends on the condition. We could do bed mobility stuff if they're having trouble, changing positions. But we can go up to like stair climbing, and even jogging if we wanted to. Even
jogging, because that way they're going to feel more motivated to get out, to go shopping, go play cards with their friends, see movies, whatever. Right. You want those things because life is a physical event, isn't it?
It really is. Yeah.
All right. So if you want to get started at MAXX Physical Therapy, how do we do it?
So it's very simple. You can just give us a call or come by our office. Our receptionists are great at getting you into the door, and you'll see me or Lauren for your initial evaluation.
How long can someone expect to participate in therapy? I assume if you're a senior, this is something that you're going to do forever.
And I would love to keep you forever. But, it depends. It depends on the condition. It depends on the person. Typically, it takes a couple of weeks. But as soon as you're confident, you're out the door,
Right. And you also are teaching them things that they can go home and try.
Correct.
Maybe I should. Maybe something as simple as taking steps more than taking the elevator.
That's not a bad idea. No, it's not.
If you can do it,
safe. Yeah,
right. If you can do it, why not take the steps instead of the elevator? Right. Or the escalator.
Right.
Or most places I go, the escalator is the stairs at that point. They don't work. So this could go on for just a few months. This is something that could go on just depending on how much the patient wants. And there's I was reading though there's home health versus outpatient therapy. Are there pros and cons to those two?
I'm more leaning towards outpatient just because I work in outpatient.
Right.
But, outpatient, especially here, you get to work with our wonderful team. You have a collaboration of physical therapists that gets to tailor and custom make your plan of care.
Right. How many are on your team right now?
So right now we have me and Lauren PTs, and we have the PTA. We have wonderful techs that work with us. And then not only that, but we have awesome equipment, new innovative equipment.
Fun.
Yeah. Oh, yeah.
It's fun to play on.
Yeah.
I probably shouldn't say that, but it is fun to play.
It really is. Yeah,
it is.
Great.
So if you're a senior, or you think you would like to become a senior, and you would like to get some physical therapy, can we call physical therapy just like life motivation almost, isn't it?
Yeah.
Then they can contact and they can ask for you. In fact, whether they ask for you or not, I have a feeling they're going to get you anyway.
Yeah, I try to.
Emily Pierce, Doctor of Physical Therapy at MAXX Physical Therapy. Russ Silvers, your CBS on the Lake guy. Thanks for joining us.